Thank you for listening to Lone Star Community Radio. This program was broadcasted and recorded live from the LSCR studios in downtown Conroe, Texas. Lone Star Community Radio is supported by listeners like you. Donate and sponsor today. For more information on getting involved with Lone Star Community Radio, contact us at lscrstudios@gmail.com or visit us online at www.irlonestar.com.
A continuación, Voces en Acción, el programa comunitario que informa a la comunidad latina. Voces en Acción, la verdad en acción. Voices in Action, the truth in action. Now, con ustedes, Jenny Ibarra.
Buenas tardes, buenos días, buenas noches, donde quiera que usted esté. Esperemos que esté en la gracia. Today, good afternoon, wherever you are. I hope that you're feeling well and you're doing okay. Again, Voces en Acción, nuevamente Voces en Acción con ustedes. Voces en Acción with you, serving the community, helping you to understand this. I'm going to take a little bit of time right now just to remind you that Voces en Acción is here to assist you getting the right information, the right feedback for the needs that the community is presenting. And in order for us to continue doing this work, we need your support. If you can please get onto our links on our websites, Facebook, YouTube, Rumble. You can go into Spotify, listen to us. You can go into the radio, 104.5 and 106.1, and TV of the city of Conroe, and you can listen to our programs. Please, it's very, 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 very particular for us to know the feelings of the community, to know what is it that we can do for you. We're serving the community. If you want to become part of this show, and if you want to bring a guest and talk to us, call us. My phone number is 832-732-4744. Again, 832-732-4744. I'm at your service. I'm the host, Jenny Ibarra Rosales, and I'm pretty sure we have a good conversation and we can bring you over and talk to you about your needs. Hoy nuevamente tomo una oportunidad para exaltar de que necesitamos el apoyo y para mantener a Voces en Acción y a Lone Star Community Radio en su comunidad. El apoyo de ustedes, tanto monetario como apoyo de cartas o de opinión, es necesario. Por favor, den like a Facebook, busquen en YouTube, estén en todas las plataformas, búsquenos. Estamos en la 104.5 y en la 100.6.1 los lunes a las 2 de la tarde. Por favor, si ustedes escuchan nuestro programa y pasan la palabra, nosotros podemos dar más información y mantener programas que a ustedes les gustan. Si ustedes quieren traer a alguien al show y hablar con nosotros, mi número de teléfono es 832-732-4744 a su servicio, 832-732-4744 a su servicio. Por favor, denos un feedback, díganos quién. Nosotros hablamos con esa persona puede ser un invitado de nuestro programa y podemos ayudarlo a pasar su palabra a la comunidad de Conroe, Montgomery y en los Estados Unidos y en todo el mundo. Hoy tenemos un caso especial. Hoy vamos a hablar sobre cosas que nos competen a todos los ciudadanos americanos y todos los que nos jubilamos o estamos en deshabilidad en el sistema de deshabilidad del Seguro Social con lo que se llama Medicare. Y tengo a una experta, una señora increíble, la señora Ruth Acevedo, va a estar hablando con nosotros. Ella trabaja con iHealth y ella es una representante licenciada por Medicare. Ella se encarga de asistirle a hacer su proceso para cuando usted se jubila o si está deshabilitado, pueda elegir la cobertura correcta médica y pueda usted aprender, porque es una cosa tan grande, una logística tan grande, el aprender cómo trabaja el Medicare a su favor. Today, I have the honor of having with me a representative of iHealth. iHealth Care. And the name of this lady, which she's a magnificent a magnificent provider. Her name is Ruth Acevedo. She's a licensed, certified by the Medicare program, and she's here. She's fully bilingual, even though the program is dedicated for the Hispanic community, because those are the ones that are suffering the most in knowing the process of how to, utilize the Medicare system correctly. She's able to do it in both, in English and in Spanish. And she's here to give us a little bit of the information that we must know in order for us to get the proper coverage when we either are in disability or in Social Security retirement. She will go through all the process with you. She will go to your house. She will talk to you independently. She will dedicate the time to search for the right program, the right, if you want to be Medicare Advantage, she'll explain you how to work Medicare Advantage. If you want to do Medicare A or B by itself, she will explain you how that works and if it's gonna affect you or not and what are the coverages. She's gonna try to minimize the amount of impact from your disability check or from your retirement check. So she's gonna try to save you money. And at the same time, she's gonna try to cut all the bridges and all the lack of information and misinformation that is within the community. So I will let you listen to her clearly and understand what's going on with our Medicare system. Our Medicare system that is, I believe personally, that it needs a lot of work. There's the Medicare system will send you the pamphlets out, will send you the information out, but there's really no communication within the company, the Medicare system itself and yourself, unless you have somebody like her that is a licensed professional that will be able to guide you through. There's tons of licensed professionals doing this right now. Regardless of you choosing Ms. Acevedo or not, because we are here just to present you one, there's 20,000 of them out there that are willing to talk to you and help you, guide you through the process. Please listen to this interview because it's very, very, very satisfying knowing so much about everything that we need to do in order for us to protect ourselves, to get the right coverage. How does A, B, C, D on the Medicare program works? What is A? What is B? What is C? All those things we need to know. Tenemos que saber exactamente el proceso de cada cosa que hay en el área de Medicare y cómo Medicare trabaja para nosotros. Medicare es un poquito incomunicativo con nosotros, sobre todo los hispanos, y nosotros pensamos que no, ya tiene Medicare y ya no hay ningún problema. No, ¿cómo le afecta a usted? ¿Cómo está pagando con su cheque, su poquito cheque, las primas que son carísimas cuando nada más tiene A y B sin tener Medicare Advantage? Todo eso lo va a explicar ella y por favor pongan claramente atención. Si tienen alguna pregunta, el teléfono de ella y el nombre y su website está en mi correo, estará puesto con esto en el aire y podrá usted trabajar con ella y ella le llamará. Ella puede ir a su casa, ella va al domicilio suyo, ella habla personalmente con la persona afectada, ella toma la información, la llena y ella se encarga de hacer el proceso. Por favor, escuchemos a la señora Ruth Acevedo, una persona increíble, un ser humano increíble que le puede ayudar a usted para salir adelante. We're going to go ahead and listen to Ms. Acevedo. She's bringing us good information. Thank you for being with us. Thank you for choosing Voces en Acción and Lone Star Community as a radio station. Thank you. Bye-bye.
Voces en Acción, el programa comunitario que informa a nuestra comunidad latina. Usted puede apoyarnos con su patrocinio, informando, promoviendo y ayudando a nuestra comunidad. ¿Tiene algún comentario? ¿Quiere hablar con nosotros? Podemos escucharle y ayudarle. Llámenos ahora al 832-732-4744. 832-732-4744. Voces en Acción, la verdad en acción. 832-732-4744.
Good afternoon, good day, buenos días, buenas tardes, wherever you are. Voces in Accion again here, bringing you the latest information. Voices in Action, bringing you the latest information for you to understand that we are here for the community, for you to understand that we're here to help anybody in need and to get the information correct. And today I have a special guest. This lady is a personal friend of mine, very sweet lady, and that has helped us and my family members to be able to acquire and get in the Medicare system without no problem. Si quiere apague el teléfono para que no le suelte. Y perdone, I'm sorry, I'm trying to just make sure everything is correct. At this point, I have with us Miss Ruth Acevedo, and she is with them. She works in, what she does is she's a consultant. She goes to your house and she talks to you about your choices in Medicare. And that's something that people don't know how to do. And believe me, she's fully bilingual. So I brought her on board so we can talk to her about what our Hispanic community is needing and what we can do so they can be informed when it comes to electing Medicare. Either you're in Social Security disability or you're in Medicare and you're offered those programs through the government, automatically she will guide you on the paperwork because it's a tedious paperwork to do. And at the same time, your elections, ask what is your plan, what are your providers, everything. She will go personally, one-on-one with you, trying to help you in that. Hoy tenemos con nosotros, y buenas tardes, buenos días, donde quiera que usted esté, Voces en Acción con usted nuevamente, para traerle la información correcta de todo lo que pasa en el mundo, alrededor de Texas, en los Estados Unidos y todo. Y hoy tengo el gusto de trabajar con ustedes, con mis ancianos, con mis personas que están discapacitadas, con los padres de familia que están trabajando con personas, con niños discapacitados y que el gobierno les provee el Medicare. La señora Ruth Acevedo está con nosotros hoy día y nos va a hablar acerca de cómo ella trabaja con la comunidad, con usted personalmente. Ella va a su casa, se sienta, le explica todos los programas y todo, y cómo usted puede elegir Medicare para su abuelita, su abuelito, para su papá, su mamá, para su niño que está deshabilitado, para usted si está deshabilitada. Esos son programas para ciudadanos usualmente americanos o residentes que están registrados y que pueden jubilarse y que pueden llegar a tener ese tipo de ¿cómo se llama? De servicio del gobierno de los Estados Unidos. Gracias, señora Ruth, por estar con nosotros hoy día.
Jenny, gracias a ti por darme la oportunidad de estar aquí.
Es un placer, doña Ruth. Usted sabe que la tengo en mi corazón bien cerquitita y que para mí es un placer estar con usted. Yo sé que usted es una persona tan educada en cosas tan diferentes que yo para mí, le digo sinceramente, fue un puzzle hacer todo lo que tenía que hacer y mi hermana y mi comadre, todos que le recomendaba a todo el mundo porque usted lo hace tan suave, un proceso que es tan largo y tedioso, lo hace tan dulce que vale la pena solamente tenerla para que...
Muchas gracias por esa confianza, especialmente por permitirme entrar a su casa y poder también hablar con la familia. O sea, para mí la confianza que me están dando significa bastante. Muchas gracias, Jenny. Muchas gracias.
I'm letting her know that I'm so thankful because she went through the process with all my family members and it was so easy. Because when somebody's knowledge, like she is, and she's able to sit down with you and tell you what are the plans that are in Medicare and how it works, A, B, C, D, all the parts work, what the government states, how to legally to put it in your information, how to form, what the forms are needed to be filled out. If she did it in Spanish with all of us, and she was able to get through things, she does it in English as well. And it was so good having her because she comes to your house and she's so sweet. She will tell you everything. Miss Ruth, how did you started this? ¿Cómo lo comenzó?
Yo saqué mi licencia en el 2004, más que todo tratando de ayudar a la comunidad en el proceso de seguros de protección en mortgage. Pero después de eso vi la necesidad desde el 2006 que empezó lo que es Medicare, los beneficios, el Medicare Advantage, que comenzaron los beneficios, vi también la falta de necesidad que había para las personas mayores que no sabían. Con el tiempo me he dado cuenta que aún todavía tenemos esa necesidad en la comunidad de entender el Medicare, porque el Medicare es complicado. Aunque el Medicare, Seguro Social, le manda un libro a usted para que mire cuáles son las reglas, lamentablemente, y no tiene que ver con el idioma, simplemente no le entendemos al Medicare la manera, la terminología que tiene Medicare. Entonces, muchas personas, no importa si es por el inglés o el español, siempre buscan a una persona que esté certificada
con Medicare,
con lo que nos exige Medicare para entender más el proceso.
Okay. She started in 2004, eventually. She was doing mortgage insurance and stuff, and she started looking at the other possibilities, and then she realized that people were not informed about Medicare, and she went ahead and certified herself in 2006 for Medicare. So she's very certified with Medicare, and she says that they send you so much paperwork, and most of the clients are elderly. They cannot even read, or they're very confused. And it's not a language barrier. It's about the way the Medicare processes the paperwork and the way the Medicare gives you the book, because they hand you a book and you read it and you don't understand anything about anything. And then she comes on board and she makes it so easy. She will go through the process. She will tell you what to do, what not to do, and how to do it. Because she says she felt that it was to help her community. All the older people, whether they're Hispanic or Americans or whatever they are, it doesn't matter. They're needing help. They're needing to go through this, and they're needing to select their doctors, and they're needing to be helped, because health insurance is something that that is all of us are needing. All of us are needing that, and it's crucial in our lives. Entonces usted agarró, se certifica y comienza a trabajar.
Medicare, sí. Y Medicare nos hace que cada año pasemos una certificación, o sea, nunca terminamos de estudiar. Tenemos que cada año entender las reglas, los nuevos cambios que hay cada año, y no solamente con Medicare, que nos hace que pasemos una certificación, sino que adicional, cada compañía que representamos, sí, también tenemos que ser certificados con cada compañía. Entonces, la importancia que cada persona, cada beneficiario tenga un agente a quien llamarle, a quien preguntarle, es verdad muy importante, porque aunque uno crea que uno sabe lo que está leyendo, a veces no es así. Entonces,
definitivamente.
Sí, es muy bueno tener a alguien al lado que le pueda ayudar.
And she's telling us basically, when they certify you for Medicare, you have to take the test every year. Mm-hmm. Every year you have to be provided with information, because you never stop learning with Medicare, I'm sorry. And then automatically, when you're doing Medicare Advantage, every company that works with Medicare Advantage, Humana, whatever, Blue Cross Blue Shields, all this, she needs to be certified with each one of them too as well. So she never stops studying and making sure that she gets the latest information for your benefit, for the benefit of every single person that comes across her. Because she says it's more easier, and she noticed that our community is relying on certified people like that in order to make a wise decision in regards to their health programs. Eso, ¿usted dónde es originalmente? Y cuéntenos un poquito de quién es Ruth.
¿Quién es Ruth? Yo llegué aquí en el año 1985.
En el 85.
En el 85 llegué acá. Entré a la escuela aquí. Sí. Gracias a Dios tuve la oportunidad de poder entrar a la escuela. Uh-huh. Fui al colegio, pero no terminé mi colegio completamente. Uh-huh. No lo terminé. Me faltó un año para la graduación, pero en eso vino la familia, los hijos, y lo dejé así. Y por condiciones médicas de mis hijos, entré realmente a trabajar en las aseguranzas.
Okay.
Eso me ayudó mucho a entender el sistema de la salud.
Okay.
Mi esposo es uno que él, por su deshabilidad, tuvo que entrar en Medicare, y todo eso a mí me ha hecho explorar más los beneficios de Medicare también.
Okay.
Exactamente.
Miss Ruth is from El Salvador, am I right?
Soy
okay.
de El Salvador.
She came from El Salvador in 1985, so she has around 38 years of being here, basically. Miss Ruth has a beautiful family, and she went to high school here, she graduated, and she started college, and probably 1 year before graduating, she got married and had started having kids. So she decided to stay at home, a wife. And she saw the necessity as well on her kids because of having health issues to get involved with the insurance part of it. So that's what brought her into all this certification of Medicare. And then her husband was disabled as well later on in life. And so she had to help him get to the Medicare part of it and everything. So she's been working on that for a long time at this point. Yes. Ms. Ruth, what is the most scary part when you go to see the elderly people and you talk to them? What they tell you, they're scared?
La necesidad más grande que yo he visto en la comunidad es que no saben, me dicen qué es Medicare. Piensan que con la tarjeta roja y blanca que ellos reciben, piensan que eso es todo lo que ellos necesitan. Entonces, la necesidad de que muchos no saben que hay ayuda extra que pueden aplicar, mucha ayuda, hay bastante ayuda, especialmente en las medicinas recetadas. No saben ellos cómo obtener esa ayuda, no saben. Lo más grande es que hay personas que siguen trabajando, que pueden tener su Medicare y ellos confunden el Medicare con el beneficio del retiro. Esa es la parte mayor que yo he visto en nuestra comunidad.
Okay. She's basically telling us that the ignorance that we have in our community, and it's lack of knowledge because of fear of asking further. A lot of people receive their Medicare card and they think that they need to continue working because basically that's just the health insurance coverage, and they don't know. They are confused. They don't know that they have. Well, I have Medicare and that's the only thing I have, and they present that and they don't know that there's in the bottom of the Medicare there's a bunch of benefits that they're able to qualify for as well, like the cheaper prescriptions, medical, especially people that are having blood pressure, things like that. They need to get their medications. The prescriptions lowers and everything how they pay, and then there's a lot of benefits to Medicare. So she says that when she goes and talks to them, they have no knowledge of anything. Most of them, they're just completely ignorant about this. And it goes not only, again, she says, not only in our community, Hispanic, but everywhere. Every community that she's facing, that's what she's facing. The lack of understanding of the Medicare program itself is completely vast. So that's why she is so much into helping people, because they need to know the way they can have more benefits, the way they can use the Medicare correctly, the way they can, talk to the government and be able to do and apply for all the benefits that they can do. Señora, una pregunta. Cuando, primero que todo, explíquenos ¿qué es Medicare? Vamos a hablar, claro, de principio qué es lo que es Medicare, porque muchas personas están confundidas entre Medicaid y Medicare, es un relajo. Sí. Vamos a clarificar qué es Medicare y cómo se utiliza Medicare a nivel de los Estados Unidos y qué es lo que es.
Medicare está compuesto por dos partes. La parte A, que se encarga de cubrir hospitales, las necesidades en el hospital. La parte B, que se encarga de cubrir todo lo que tiene relacionado con doctores, laboratorios, ese tipo de cobertura. Y ese es Medicare original.
Okay.
No viene con nada más.
Nada.
Hospital, doctores. Es
Punto.
todo lo que trae. La persona es responsable. Si la persona nunca escoge un plan, aparte de Medicare, que se queda así, y es verdad, la mayoría de las personas creen que esa es su cobertura. La A y la B son responsables de pagar un 80% si van al doctor o al hospital. En el hospital hay un deducible que las personas no lo saben, es de $1,556 y cambia cada año, no es fijo. Cada año cambia ese deducible de la parte A, si se quedan con puro Medicare original. O sea, esta es la falta de conocimiento que yo más encuentro en la comunidad. El no saber estos costos y estos cobros hasta que ya es tarde.
Cuando ya le llega el bill.
Cuando ya le llegan los bills, cuando tuvieron una emergencia, fueron al hospital y ya les viene todo eso, ellos no sabían. Esta es la parte más que me preocupa en la comunidad, es que piensan que solamente es el 20%, pero no es así, es el 20% de los tratamientos, de los tratamientos aprobados por Medicare. Aprobados es una parte muy importante.
Muy diferente la palabra, exactamente.
Exactamente.
Okay, basically I said, we're going to talk about Medicare. What is Medicare itself? Medicare is basically, of course, you know, the government insurance that is given to elderly when you retire at the age of 62 or 65, depending on the bracket that you're in. And automatically that right there has Medicare Part A and Medicare Part B, okay? It's divided in two. Okay, that's the original Medicare. Part A is for the hospitals. Everything to do in the hospital. Whenever you have an emergency, you go to the hospital. Whenever you have sick, you go to the hospital. You have surgery, you go to the hospital. That's what Part A is going to cover. Part B is especially for doctors. Every time you go to a doctor's office, every time you go to a specialist, every time you go to a chiropractor, that's Part B that will cover it, okay? So automatically right there, then that's what you have. People are so into, well, that's what I have and that's it. No, Medicare has a broad band of elections. You're able to not only have that, but have other things. But when they come to her, they sometimes go and apply and they go, like for example, they have to go to the hospital. There's a deductible of the hospital that grows by year. Every time you go and you use only the Medicare card, you will pay a deductible of $1,500 when you go to the hospital. So you don't know that until you go to the hospital, and then when you come out, you receive the bill. And you're like, but it's only supposed to be the 20%. No, it's the 20% that is approved by Medicare. So basically, you need to be approved of the treatment so they can cover, and it's that 20%. So there's an if you're getting a small check of $900 for your retirement, for example, and you have to pay $1,500 on a hospital bill, you're gonna be really like flip out. This is going to happen. So she's having that information right there. She's saying that the lack of understanding on the process is what making it harder for you as a senior citizen, or for you as a veteran, or for you as a disabled person to get the proper care that you need at a low cost. Entonces, básicamente es horrible el ver de que llegan al hospital, van al hospital, le reciben un bill y ya se asustan y no saben qué hacer.
He tenido bastantes experiencias exactamente que hasta que ya les ha sucedido el incidente, ven los billes grandes y dicen, ¿y qué hago ahora? Yo no sabía. Bueno, Medicare, más que todo es un plan de salud, ¿verdad? Mm. ¿Quiénes califican para Medicare? Personas de 65 años en adelante, personas deshabilitadas por alguna condición menores de 65 años, con la condición médica ALS es una condición médica que hay, las personas que la tienen saben de qué tipo de enfermedad es, y las personas que padecen de los riñones que están en diálisis permanente, y son deshabilitados por el Seguro Social.
Okay.
Esos son los cuatro.
She's mentioning 4 things. The people that are covered by Medicare usually are 65 up, people that are retired, disabled people, anybody with a disability, whether it's a young kid that is disabled because of being born, whether it's an adult that is disabled for X or B reason, that person, persons that have ALS, and persons that have kidney failures. Those are the persons that are automatically certified by the government with the Medicare program. And that's what she says, that it's sad seeing that they're having bills, having this low income, having this a lot of stuff. So she has to go ahead and retrain them how to process every year. Now, creo que ahorita comienza nuevamente la elección de Medicare en octubre, ¿verdad?
Sí, tenemos en octubre es cuando lo que se llaman el annual election period. Sí, annual enrollment period comienza en octubre. Bueno, oficialmente es octubre 15,
okay,
hasta perfecto. Diciembre 7.
Hasta diciembre 7.
Que es cuando uno se puede registrar, pero desde el 1 de octubre uno ya puede empezar a hablar de los beneficios del plan.
Ok, los beneficios del plan. Cuando usted tiene Medicare, hay lo que se llama Medicaid Advantage, que eso es lo que siempre escucha todo el mundo en la televisión. En la televisión escuchamos todo el tiempo, aplique para Medicaid Advantage AARP, aplique para United Health, porque todas compañías salen con que están con Medicare Advantage. que nos explique ahorita mismo qué es lo que Medicare Advantage. She's going to go ahead and explain us right now, and I ask her, there's several processes within Medicare, and one of them is the big program that is called Medicare Advantage. And that's something that all of us need to listen to, because that will save us a lot of money, a lot of money. You probably will end up not paying a zero and getting a lot of benefits just because of electing the right program. Go ahead. Entonces,
¿qué es Medicare Advantage? Medicare Advantage es prácticamente las letras reunidas. La A, que está donde va lo del hospital. La B, que es lo de los doctores. La C, que donde ya lleva integrado la medicina recetada.
Ok, perfecto.
¿Qué es Medicare Advantage? Es la reunión de los beneficios juntos, encima de beneficios extras que Medicare original no cubre, como exámenes de la vista, rutinarios, gimnasio, muchos beneficios dentales, lentes, o sea, muchas otras cosas que Medicare original no tiene. Está el Medicare suplemento y está el Medicare Advantage.
Okay.
La mayoría de las personas es donde se confunden y no saben qué elegir. ¿Un suplemento o un Medicare Advantage? Okay. Un suplemento, usted tiene la libertad de comprar un plan y puede usar cualquier doctor, cualquier hospital. Medicare Advantage, tenemos que estar dentro de una red.
Okay.
¿Cuál es el plan correcto para cada persona? Depende de la libertad que cada persona quiera tener en la atención médica. En el suplemento tienen esa libertad por un costo adicional. En el Medicare Advantage
no tienen ese costo adicional. Y todo depende del plan que escojan y la red que haya con cada plan. Okay, she's explaining it quickly, and I'm just going to go and revise this. It's a little bit broad, so you guys can have an idea. Sí. There's Medicare Supplement and there's Medicare Advantage. Medicare Supplement is basically you elect the kind of doctors that you want to and everything that you want in a whole package. They will deduct it out of your check, that's for sure, and it's depending of your capability, what you want. You have what they call the Medicare supplement. Now, Medicare Advantage, and she says, is a whole component. Basically, it's A, hospitals, B, providers, C, medications. In the top of that, those programs that are within Medicare Advantage, they offer you vision, dental, and they offer you gym. They offer you they have so many different things that will offer you, okay? The individual programs that are within Medicaid Advantage, okay? So it will come to you in a package and you will have to decide, and you'll go into the internet and you're looking at it and go, what is this and what is that? So that's where she comes in and she sits down and says, what is it? What kind of doctors are you looking for? What kind of providers are you needing? Do you have pre-existing conditions? Do you have this? So she will ask you several questions, and she will help you to choose someone in that network, because you have to be in a network. When you get Medicare Advantage, you're either into the network of the Devoted, or the network of United Healthcare, or the network of Humana, or the network of Blue Cross Blue Shield. There's all these networks that are there. So basically, you choose your network. Your doctors are within that network. So usually when somebody comes to you and says, well, I want to keep my own doctor. So she's going to try to look for your doctor within those networks. If he or she is registered in those networks, bingo, you got it. They usually look, some of them are PPO, some of them are HMO, depending on what you want to. But it's your choice again. Again, we go back. You have the choice of electing all this big network. You have the choice of several insurance companies that are working with it. And guess what? It's 10 times cheaper. You probably pay what the Medicare will take out of your check only, and you will have more benefits than probably doing Medicare supplement or doing Medicare by itself. So that's what she's saying. No sé si lo expliqué correctamente, pero creo que...
Lo está haciendo muy bien, la verdad que
porque
sí.
Realmente ahora aprendí todo eso, ¿no? Y ahora me di cuenta de que nosotros como comunidad tenemos que enseñarle. Imagínese si una persona adulta que le acaban de decir y que no tiene el conocimiento. Ahí es donde viene usted y usted se sienta con ellos y usted habla con ellos y les explica qué doctores usted ve y las preguntas que hacen regularmente y usted se encarga de llenar el formulario para ellos,
Sí.
para que ellos ni siquiera tengan que batallar haciendo eso.
Sí, claro, ese es el trabajo que yo me encargo. Más que todo que usted entienda qué es lo que usted, en qué está entrando. Está entrando en un plan, cómo entender el plan. Y créame que como es bastante la información, no todo lo que yo le diga se le va a quedar, porque es mucha información. Siempre me va a llamar y me va a decir, ¿qué hago ahora? ¿A dónde voy? ¿Cómo está la medicina? Entonces, para mí, la verdad, me gusta lo que hago, me encanta porque he visto a pasar de los años cómo he hecho la diferencia en muchas personas que han necesitado bastante la ayuda.
Definitivamente. But basically, she says that what she likes of her job is that she's able to guide you through the whole process. It is so much fun seeing how she just fills out the form. She asks you questions. She guides you. She gives you different choices. You make your choices, and you tell her, and she fills out the information for you. That's what she's hired by Medicare, so she can do this. She's a broker, and she's able to sell you the information and give you correct information that applies to your personal identity, to you as a human being. What you need, whether you're a cancer patient, whether you're a diabetic person, whether you're having problems with your kidneys, whether you're a healthy person and you don't have any problems, or whether you want to pay, don't self-pay, you want to elect your own provider, whatever it is, you give her to her, and she will give you the plans, and she will give you the advice that you need in order for you to make sure to get the right information on time. And then, now, there's an opening, and she explained her, there's an opening from the October the 15th to the 7th of December. December the 7th. And that's a new enrollment area. That's when she's most busy probably. But, that's when you have to have, before the 7th of December, you have to have a new enrollment. If you're in Medicare A and B only, and you want to get in Medicare Advantage, that will be the time that you're able to do it every year. Every year they're open from October to December the 7th. You contact Miss Ruth, and Miss Ruth will be able to assist you guiding through every single one of those processes. And if you're in AB or supplement and you want to change, she will help you how to drop one and get the other one, whatever is your choice for your own personal, treatments, because some of those have different type of treatments. Una pregunta que le iba a hacer a usted era referente. Muchas personas dicen, bueno, y ya cuando me cambian todo y cuando lo hace todo, ¿cómo yo puedo hacer para sacar las citas? ¿O qué es lo que tengo que hacer primero? Cuando yo saco la cita con la doctora, ¿ya va a tener mi información ya o no?
Una vez que usted ya está inscrita, le va a venir su tarjeta, y al venir su tarjeta, usted va a llamar a la doctora que usted escogió, que asignó, y de ahí pues va a empezar el proceso.
Ok. Así que los doctores no saben que uno está ya inscrito. No, uno tiene que presentar la tarjeta y decirles que yo estoy inscrito y que ellos son mis providers.
Sí, ellos son.
Okay.
Sí, usted tiene que llamar, darles la información y todo, y ya ellos automáticamente van a verificar que son su doctor, que está dentro de la red, y de ahí comienza el proceso.
Okay. Basically, and I ask her this, it's a dumb question, but I had to ask her. Whenever you receive and you fill out the paperwork and she sends it, what is the next step? And I said, do you have to call your doctor, or your doctor already knows? And she says, well, you have to wait until the card. You receive your card in the mail, and automatically when you receive your card from the Medicare Advantage program that you're in, when you receive the card, then you call your doctor and you set up the appointment, because they're going to ask you, are you with Medicare? And if you say yes, who's the provider? And your provider is usually in the card, and the phone number is there. And then you call the provider, and that's the provider that you selected. Automatically, that provider will give you. Sometimes they need sometimes some programs will need a referral. Sometimes some programs do not need a referral, depending on what you choose, okay? Like I said, PPO versus HMO. Some HMOs are very, very well. Some PPOs are very well. And then those HMOs and PPO are within another network, and we're going to talk about that.
Esa es la parte en la que quería ir.
Okay.
Medicare Advantage tiene variedades. No es solamente Medicare Advantage y un network. ¿Okay?
Ajá, exactamente.
Tienen las opciones del PPO también, donde puede que pague un poquito más. Algunos pueden tener prima, otros no pueden tener nada, pero usted tiene la libertad de ir dentro de la red y fuera de la red pagando un poquito más. Pero siempre le va a ser más económico que comprar a veces un Medicare Supplement.
Okay, dice claramente, and she says clarifying it to us, there's the Medicare Advantage have the different type of settings, HMO, PPO. If you want a PPO, you're able to get it. And a PPO, basically, you guys, is your personal provider. And basically, you're going to pay a little bit more, but it's going to be less money than if you take Medicare supplement. Okay, because with the Medicare supplement, you will pay high costs, and if you're living on a cut income, you do not need to go to supplement. So I'm gonna be honest with you, you don't need to go to supplement like that, unless you have the money to pay it, and if you wish to do it, you can go ahead and do it. But I will say that if you're saving money and you're trying to save money, this is that's why they keep pushing in every single one of the networks the Medicare Advantage. If you keep listening, every single minute. They have a advisor on the TV and networks, Medicare Advantage, and nobody knows about Medicare Advantage. This is what she does it. There's thousands of people that are working with Medicare doing this. Miss Ruth is specialized for many years doing this. Give her a call. We're going to get her information. It's in my system. You can contact her, and she will set you an appointment. She will go to your house, and she will help you elect from October the 15th all the way to December the 7th. She will sit down with time, and she will give you all the information that you need to know in order for you to make the right choice.
Otra corrección también de parte mía, ¿verdad? Porque está el Open Enrollment, que es cuando comienza en octubre 15 hasta diciembre 7. Ese es cuando todos podemos escoger un plan, hacer cambio de plan. No pasa nada de esa fecha a esa fecha, pero también hay periodos especiales donde las personas durante el año, lo que le llaman Special Enrollment Period, muchas personas pueden calificar tal vez porque tienen ayuda extra en sus medicinas recetadas, porque tienen Medicaid, por varias razones pueden calificar durante el año para inscribirse también o escoger un plan, o condiciones médicas también nos pueden hacer elegibles para escoger un plan, o sea que no necesariamente tiene que estar amarrado al plan todo el año o esperar hasta el Open Enrollment.
Okay, she wants to clarify something. Whenever you, when she says open enrollment from the 15th of October to the 7th of December, that's open enrollment for everybody that is in Medicare right now. Now, she says, there's people that are not in Medicare, and they were granted Medicare, and they're able to qualify during the year, February or March. There's what they call special registrations that you can register within the year, and that doesn't need to be on the open enrollment, and it's because you were just granted Social Security disability, or you just qualify for your for X or B reason you're qualifying for Medicare. So if that can be done prior to the open enrollment, and you can easily contact her and she will do the same process with you, because everybody's case, Medicare has those type of sessions, special enrollments, that's what they call them. So you can go ahead and do your own Medicare on time, and you don't have to wait for the open enrollment of granted usually every year. You can do it prior to that, and she will guide you through the whole process as well. ¿Qué quisiera decirle usted a la comunidad entera? ¿Qué es lo que usted quisiera darles a entender para que ellos sepan que pueden confiar en todas las personas como usted? Porque hay muchos como usted que quieren ayudar para poder conseguir ese conocimiento claro en Medicare.
Que no tengan miedo, preguntar primero que nada. Si alguien, hoy en día tenemos a tantos agentes en diferentes tiendas, en Walmart, en H-E-B, en Kroger, en muchos centros tenemos agentes que están a veces con su banner, con su mesita, dando información, que si tienen una duda, acérquense a estas personas, son de confianza. Somos personas que no solamente estamos licenciados por el estado de Texas, nos han puesto fingerprint, nos hacen estudiar, somos personas de confianza. Y no solo eso, de conocimiento, especialmente en el área de salud con Medicare. Que no tengan miedo, que se acerquen, que pregunten, porque lo que pierden es mucho a no hacer nada. Porque el problema mayor que yo he visto son las penalidades que las personas que Medicare les pone, el 10% en su cheque de retiro por no haberse inscrito a tiempo, las penalidades por no haberse registrado con un plan de medicinas recetadas, es una penalidad permanente, no es solamente una vez, es una penalidad permanente que hay. Entonces, eso es la prioridad. Y más que todo, lo que he visto, la necesidad en la comunidad de que no saben que pueden calificar para ayudas extras y no pagar tanto en sus medicinas. Esas ayudas están y no las están recibiendo. Entonces,
she's saying that and I asked her what she would like to say to the community in regards to it, and she says, please do not be afraid. There's so many of these agents like her that are working for the benefits of the elderly, people that are disabled, and people that are retired, veterans. If you need help, please go and talk to them. If you see them in Walmart, Kmart, whatever you are in the world, or whatever you see them in the United States, you see those agents and they're passing their information. If you have a question, approach them, ask them. Because the more you know about the program, is the less way of getting penalties. She says that there's permanent penalties when you, for example, if you don't select the correct, the correct medicine plan, for your prescriptions, if there's a penalty that they put for you permanent if you don't select the correct one. There's penalties every time that you enroll late. All that stuff, you're not knowledge on this. And if you're needing to get this information, the book that they give you from Medicare is not going to help you because you're going to be reading it and you're not going to understand it. It's better for you to talk to an agent that is able to give you the knickknacks of each thing and guide you, because these people are not only certified by the state, their criminal background checks, everything. Every year, they have to process themselves. They have to go to process of training. They have to do everything correctly because guess what? They have the best interest for you, and the government wants to make sure that they're certified on the programs that they're offering, okay? The other thing, the lack of knowledge, that the more that you get to know the Medicare format and the way you can do things, is the more that you get to know that there's advantage of benefits that Medicare will provide you that they don't tell you, but there's a lot of advantage that you can get, a lot of benefits that will cover you and things that you will need further down the road. They even help with assisting, like wheelchairs, with help. They'll help with hearing aids. They help with even exercise. They take you to do silver, in the gym and things like that. They pay for everything, and I know that. So taking advantage of what she's offering, and everybody that is in the Medicare Vermont area and it has been trained and is certified. They have to be certified Medicare. Go ahead and talk to them, and they will guide you too. Okay? And she's telling this to the Hispanic community as well. Ya escucharon a la señora Ruth. Nuevamente, la señora Ruth les dice que por favor, si ustedes necesitan, no se queden callados, averigüen, pregunten. Si el nombre de ella se llama Ruth Acevedo, su número de teléfono, ¿cuál es? 281-541-9363. 9363. Nuevamente, her phone number is 281-541 9363. And she speaks English, okay? She's not speaking English because she's a little bit shy, but she speaks English, so she's able to do the process in English as well. So please call her. She's able to talk to you, and she's able to sit down, and you, your wife, or whoever it is, your parent, or if they're ill or whatever, she's able to cater directly to you with confidence, with security, that nothing that you give her is going to be out there, because they have HIPAA law, and you're protected by the HIPAA law. And at the same time, she's a professional on this for many years. Miss Ruth, it was a pleasure. Era un placer tenerla aquí usted nuevamente. Para mí es grande el haber hablado con usted y darle a la comunidad la información, porque es lo que yo más quería. A sus órdenes, cuando quiera, usted sabe que estamos a las órdenes. Voces en Acción está para proveer la información de todos y para al mismo tiempo darle a conocer. Voy a poner su información en todas en mi pantalla y todo, para que ellos vean y cualquier cosa la llamen a usted directamente.
Gracias. Y esto nomás es algo, yo sé que fue algo muy corto, pero es mucha más la información que hay en lo que se refiere al plan de salud y al plan de Medicare Advantage, porque hay personas que todavía están confundidas entre qué es Medicare Advantage. En el futuro volvemos a volver a hablar, exactamente. Para poder hablar, porque las personas tienen miedo y dicen, es que tengo miedo de perder Medicare por inscribirme en un Medicare Advantage. No es así, pero es más que hay que saber, hay que estudiar, ¿verdad? Para dejar a conocer que no deben de tener temor. Primero que nada, su Medicare es lo primero. Medicare Advantage es un seguro secundario que ellos van a tener, que les va a cubrir lo que no cubre Medicare. Es mucha más información, pero a lo mejor en el futuro
más detalles.
Más detalles.
Exactamente.
De cómo poderlo entender un poquito más. Pero sí es muy bueno saber, no tenga miedo, afuera hay mucha información y hay muchos agentes como yo, como usted lo dijo, que están dispuestos realmente a ayudarle.
Okay, she says basically thank you for having her here, and at the same time to make sure that you're not afraid to ask. Asking and gathering the right information is the only way that you can do the Medicare part of it and make sure that you are covered, and then not to be afraid, Medicare Advantage does not affect your Medicare at all. Eventually helps you having it. And at the same time, she says later on, further down the road, we're going to have another show where she's able to explain us detail more about it. Thank you so much for your participation in our show. Thank you for being with us again. Please support Voces en Accion so we can bring you more of our shows with all the information that you're acquiring. Please give likes to our Facebook page and donate and be our sponsors. We need sponsors. So, and if you know somebody that wants to give the information out and wants to have a talk with us and come and give their information to the public, you're welcome to contact us at 832-732-4744. Again, 832-732-4744. I'm at your service, Jenny Rosales from Voces en Acción. Gracias nuevamente, nos vemos en el próximo show. Por favor, den like en todas nuestras webpage y por favor apóyennos donando y apóyennos participando con nosotros cuando ustedes deseen. Mi número de teléfono 832-732-4744. Que pasen buenas tardes. Chao.